Thank you for joining us for the Active Health Management webinar series sponsored by ActiveHealth and the Commonwealth of Virginia Department of Human Resource Management, Office of Health Benefits. My name is Sarah, and I am the ActiveHealth Account Manager. Representatives from DHRM's Office of Health Benefits are also attending today's webinar and will assist as needed in answering any questions at the end of our presentation. The main content of each webinar is 15 minutes, and there is a 15-minute question-and-answer session at the end. During the question-and-answer session, you can submit your questions by selecting Chat in the upper right section of your screen. We will review your questions and either respond to you directly, or we may share your question with all webinar participants. Please reserve your questions to the topic we are discussing today. Each webinar is recorded and available for future reference, along with a transcript of the question-and-answer session. The archive session will be available under the Benefits Administrator tabs on the DHRM website. This monthly webinar series is designed to inform and educate you on important topics related to the free health and wellness programs provided by ActiveHealth. With this information, you will be ready to communicate to current and newly eligible participants on the unique features of the program. In November, we reviewed the health and wellness incentives. Today, we are reviewing MyActiveHealth.com. For our final installment on February 25th, 2016, we will review how COVA Health Aware members can earn dollars for their health reimbursement arrangement by completing due rights. As you can see, the webinar topics are all related and designed to build upon the prior webinars, so you will get more benefit if you participate in each session or listen to an archive session that you may have missed. We are excited to present these educational webinars to better support your role as a benefit administrator. In addition, this webinar is also designed for use with your employees. And with that, let's begin. MyActiveHealth is a website for storing all your personal health information in one secure, confidential, and convenient place. It helps you see how healthy you are and shows you how to make improvements. It also provides tools that help you track your progress along the way. MyActiveHealth is available to eligible members who are enrolled in COVA Care, COVA Health Aware, and COVA HCHP medical plans. Covered employees, retirees, and their spouses' dependents are also eligible. Key features of the website include the health assessment, personal record, digital coaching, and health trackers. The site also offers fun, interactive tools such as games, recipes, and videos. MyActiveHealth can be accessed on your PC, tablet, and smartphone, and the web address is www.myactivehealth.com/COVA. The home page is your starting point for all of the information and tools on MyActiveHealth. Here you will find a welcome message from the Commonwealth of Virginia, information on the Premium Reward Program for eligible COVA Care and COVA Health Aware members, action items personalized to your health derived from health assessment responses and medical claims data, a snapshot of your most recent biometric values and health trackers would show your health progress and current health stats. Lastly, there is a section where you can outreach to an ActiveHealth nurse, health coach, or care manager. For those of you enrolled in the COVA Health Aware plan with Aetna, you will also see a link to the Do Right Reward Center. The Do Right Reward Center will be covered in the February webinar. Let's explore the left-hand menu bar. First is the My Action Plan page. On this page, you will find action items, goals, health trackers, health links, a symptom checker, and quick access to forms related to your health information such as your vaccination history and general health record. Action items are the top health actions you could take to improve your health. These might include taking a health assessment, updating your personal health information, or signing up for health coaching. Menu options include access to digital coaching, health trackers, resources, and devices and apps. Let's take a closer look. Digital coaching is designed to inspire, motivate, and introduce healthy lifestyle actions to your daily routine. Featuring over 150 topics and 22 categories, digital coaching provides information on chronic conditions such as diabetes, high blood pressure, and asthma, in addition to lifestyle topics such as nutrition, stress, and exercise. The modules provide both topical and acute content, and the selection of topics grows monthly. In addition, digital coaching also features insightful articles, games, videos, and more to keep you on the path to a happier and healthier you. Digital coaching is accessible via PC, tablet, and smartphone. The Devices and Apps section allows you to sync your favorite device or app to your activity tracker. MyActiveHealth can sync with most of today's popular devices and apps, such as Fitbit, MyFitnessPal, Jawbone, Garmin, and many more. Syncing your device or app to MyActiveHealth can be especially helpful if you are working with an ActiveHealth nurse or health coach and are tracking your blood sugar, blood pressure, weight, or daily activity. Simply scroll to the picture of your device and click on the Connect button and follow the prompts. You can also select from a list of available devices and apps. Under Resources, you will find a large library of tools and tips on a range of health topics, including healthy recipes with macronutrient profiles, interactive tools, browsing topics, videos and audio files, and finally, a wellness center where you will find the ActiveHealth monthly wellness webinar recordings. Now let's take a look at the My Health tab. Here you will find the health assessment, which is a brief questionnaire about your health record, which is your health history, medical claims, prescriptions, and labs, all in one secure, convenient location, and messages, appointments, and documents, which we'll cover in more detail later on. First, let's take a closer look at the health assessment. A health assessment is a tool that shows your state of health and helps you track your health information. At the top of the health assessment page, you will see a personal introduction message. The page also displays your assessment completion status. This feature lets you see how much of your health profile you have completed. The health assessment is interactive. This means if you answer a question a certain way, you may be asked extra questions. For example, someone who checks asthma will answer other questions about that condition later in the assessment. There are several different sections of your health profile. You must click on Work on It to complete each section. If you have already done this, you will see the word Completed display. Upon completion, you will see your health report, which is based on your goals and the areas of your health that need improvement. It shows the actions you could take to improve your health and start feeling better. The report also includes a score for your overall health risk and information about specific tools that can help you improve your health. Your personal health record contains information about your overall health care. It includes details about the doctors you currently see and past visits with your doctors. You can edit your health record as needed. This makes it easy to track your information in a way that suits you best. You can also see a record of your insurance claims on this page. You're also able to access the personal health record for any of your minor dependent children. Once your minor dependent child turns 18, your access to their personal health record will end automatically, and only the adult dependent child will have access to their own personal health record. Now that we've reviewed the personal health record, let's take a look at how ActiveHealth receives member information, the Health Insurance Portability and Accountability Act, commonly known as HIPAA, and how ActiveHealth receives member information and who has access to the personal health record. The HIPAA privacy rule provides federal protections for your personal health information held by covered entities and their business associates, like your health plan and ActiveHealth, and gives you an array of rights with respect to that information. At the same time, the privacy rule is balanced so that it allows the sharing of health information needed for patient care and other important purposes. So how does ActiveHealth receive member information? Notice that you had a doctor visit, filled a prescription at your pharmacy, or had testing completed at a lab is sent to ActiveHealth by your health plan. Our data specialists validate your information against the codes and descriptions established for medical claims, diagnoses, procedures, drugs, and medical devices. Once validated, your information is organized into your personal health record. Your personal health information is never shared with the Commonwealth of Virginia. All COVA employees, spouses, and dependents are protected by all federal and state privacy laws. Your health information cannot be used to affect your employment in any way. Who can access your personal health record? Only you have access to your personal health record. If you decide to work with an ActiveHealth health coach, they will be granted access to your health record so you can review your history together. You also have the ability to grant access to your doctor, your spouse, or anyone else who may be helping you manage your health. The Commonwealth of Virginia cannot access your personal health record. And your privacy is our priority at ActiveHealth. ActiveHealth works hard to keep our customers' information private and secure. We comply with or exceed all state and federal requirements for maintaining personal information, and we take great care to keep your information safe online. Now let's take a look at the Messages, Appointments, and Documents sections. Here you can view important messages you may have received from ActiveHealth, such as health alerts. An example of a health alert would be seeing a reminder to get a flu shot. You can also see upcoming appointments if you're working with an ActiveHealth nurse or coach. You can also upload and store copies of your important legal and health documents to the website. In an emergency, you'll be able to download these files from any computer linked to the Internet. Some additional documents can be very helpful to store on the site. These include a copy of your living will, medical records, scans, or x-rays. The final section to review is the Account Settings feature. From any page on MyActiveHealth, you can access your account settings by clicking on the image next to your name in the top right corner of the screen. This allows you to view and update your information. You can update personal information, settings, preferences, and access control. Access control is a page that lets you view and control who sees your and your children's information. You can also give access to adult dependents covered by your insurance plan. After you complete their information, they will be mailed a username and password. If you set up access for your adult dependents, make sure their information is correct so that these items will be sent to the right email address. And that concludes our overview of MyActiveHealth. For questions or assistance with MyActiveHealth, please call us toll-free at 1-866-938-0349 or visit us online at myactivehealth.com/COVA. Thank you for your time and participation today. Please mark your calendars for February 25th, 2016 to participate in the final ActiveHealth Management webinar, COVA Health Aware Incentives. You will receive an invitation in advance and can always access the archive sessions from the DHRM website. We hope you found this information on MyActiveHealth valuable and will now welcome questions related to today's webinar topic. Question number 1. Is my permission needed to populate my personal health information in the MyActiveHealth portal? No, your information is automatically sent to ActiveHealth by your medical plan. The HIPAA privacy rule allows the sharing of your health information from your medical plan to ActiveHealth. Question number 2, how does ActiveHealth protect my information? To protect the confidentiality of information and/or electronic data, including protected health information as defined by HIPAA privacy rules, ActiveHealth utilizes the following physical and electronic safeguards: authentication and passwords, internet security and encryption. We use secured socket layers at 128-bit or higher data encryption to prevent unauthorized users from intercepting transmitted data. Data is protected from unauthorized external access through the use of proxy servers and firewalls. Access. Electronic data is not stored in any shared common network file storage areas. We also impose user restrictions upon individuals authorized to access electronic data to limit their access. And physical security. The physical environment of computer systems containing data is highly secured. Each ActiveHealth data center is constructed with power supply redundancy, sophisticated environmental controls, and a full security system that limits physical access to computer hardware to only individuals holding a valid electronic key card and a personal identification number. Question number 3, can I remove myself from the MyActiveHealth portal? Yes, you may opt out of any or all ActiveHealth services. To opt out, simply call ActiveHealth at 0349 and speak to a customer service advocate. Please note that if you opt out of MyActiveHealth, you will not be eligible to earn COVA premium rewards or COVA Health Aware incentives. If you are eligible to earn health coaching incentives for medications and supplies you use for a health condition, and you opt out of the health coaching program, you will not be eligible to earn any available incentives. Question number 4. If I forget my username or password, how do I get that information? So at the login page, you have the option to retrieve your username and password. Simply click on the options listed and follow the prompts. You can also call ActiveHealth at 1-866-938-0349, and a customer service advocate can provide assistance. Question number 5. What happens to the personal health record of a minor dependent when they turn 18 years of age? So once a minor dependent child turns 18 years of age, the access of the parent guardian to the personal health record ends automatically, and only the adult dependent child will have access to their own personal health record going forward. This concludes the Q&A portion of the MyActiveHealth webinar. Thank you for your time and participation today, and we look forward to everyone joining in February for our review of COVA Health Aware incentives.